This is a video tutorial for successful COMBY EEG CAPS setting according to International 1020 system. Before starting to work with the COMBY EEG CAP, please consult the instructions for usage. There are 6 different sizes of COMBY EEG CAPS, 3 for children and 3 for adults, with additional 7th size for newborns. Also, we need these accessories prepared before the recording: medical alcohol, abrasive gel such as NuPrep, and adhesive conductive paste such as 1020 paste. Or if you're using gel, use COMBY electroconductive gel or other available EEG electroconductive gel on your market. You might also need a bypass electrode and a chest belt. There is a head size measuring tape, syringe with plastic add-on for gel application, and cotton stick and pads included in your COMBY EEG CAP package. In case you need to connect the cap via adapter cable, you will also need to order the adapter cable corresponding to your EEG device. To start, we need to define the referent points on the patient's head: nasion, inion, and 2 pre-auricular points on the left and right side in front of the ears. It is imperative to choose the correct cap size to achieve the correct recording. To measure, use the head measuring tape supplied with every delivered COMBY EEG CAP. The tape has colored marked spans for each size, so you can easily see which size you need immediately. Sizes of caps are also visible from the colors of the COMBY EEG CAP. Instruct the patient to come to the recording with clean and dry hair and without any gel or foam on the head. First, move the hair from the forehead and then clean the forehead with a cotton pad soaked in alcohol. Put the hair behind the ear and then fix the rest of the hair with a hair string. Put the piece of paper towel under the chin. Put the cap on the head. Electrodes must be symmetrically placed over the head, while the middle row is placed over the medial line. If we have a cap with A1 and A2 electrodes, we have the possibility to position it on the mastoid or on the earlobe, without needs for special ear electrodes with clip. For a sensitive patient with cannula or with breathing problems, use the chest belt. Fill the syringe with conductive gel. After, put the add-on tip for gel application on the syringe, which will be used as a hair remover too. Lift the electrode on front, left or right side. Never lift on the back side. Remove the hair with the syringe add-on and then apply a small amount, just a drop of conductive gel on the skin, and slightly press the electrode on the spot. Gel should be under the electrode and not around the electrode on the scalp. After you have positioned the cap correctly, put the patient in a comfortable position, chair or bed. When we connect the EEG cap to the EEG device, we must check the impedance of the electrodes. If there is no 25-pin connector on the head box, then the cap should be connected via adapter cable. If some of the electrodes are red, which signals high impedance, the electrode contact must be corrected. Then clean the skin with a cotton stick soaked with alcohol or abrasive gel. If there is no contact after additional cleaning, then it means that the electrode is broken, and in this case, use the bypass electrode, which is put instead of the broken electrode in the same position. After the recording, remove the cap from the patient's head and clean the residual gel from the patient's head. When you use the COMBY EEG CAP correctly, it will have a much longer lifetime. The common mistake that technicians make are that only one size of the cap is used for all patients. Usually this is the middle size red cap. This leads to the incorrect detection of the specific regions of the brain. Also, sometimes the technicians move the holders of the cap upwards, which causes the temporal electrodes to be too close, causing low EEG amplitude and leading to wrong interpretation of EEG. If you use the correct size of the cap, there will be no need to move the holders on the cap up or to frequently move the rubber strings. When deciding on the purchase of COMBY EEG CAP, immediately acquire a set of all cap sizes you will be using, according to your patient population. If you must absolutely move some of the electrodes due to skin injury or nevus or similar, always report this in the recording report and move the electrode back to the original position on the cap. Someone pushed 25-pin connector of the cap to the 25-pin connector on the head box or adapter into the connection facing it the wrong way. Regular maintenance and cleaning of the cap is really simple and quick. Correct maintenance is necessary to achieve the good lifetime of the cap and ensure the correct recordings. To achieve the best recording result, you need to have COMBY EEG cap maintained, cleaned and stored correctly. After the EEG recording, disconnect the EEG cap from the device and remove the cap from the patient's head. Clean it with warm tap water with disinfectant or hand soap. If absolutely necessary, use a soft toothbrush to remove residual gel in the electrode. Dry it with a paper towel and leave to dry. If you need to use the cap immediately, dry it completely with a hairdryer. The process, as you can see, lasts for 1 minute. The cap is immediately ready for the next recording. If you must disinfect the EEG cap or electrodes, and only if necessary, use the minimum percentage of disinfectant solution needed to achieve the disinfection according to the producer's instruction. Always store your COMBY EEG cap and electrodes in a dry space and dark place. Do not expose the caps to direct sunlight. It is recommended that you use the cap not later than 2 years after production or after 1,500 recordings. COMBY EEG cap is electronic equipment and should be disposed according to local regulations for disposal of electronic waste. To ask any question on these or other topics related to our products, mail us to pamel@pamel.hr.